Well, that's a very good question, isn't it? Because if you do your research on the internet, you might be left with the impression that some implant brands are superior to others. Well, I did breast implants for 25 years in Australia, maybe 6,000 pairs. And so I've used most of them over the years. The truth of it is, of the implants that are available today in Australia, that means that they're all approved by the Therapeutics Goods Administration, the TGA, to be used in Australia. They're all good implants. Is one particular implant better than another implant? I don't think so. I don't think the long-term evidence shows that there's any standout performer. There might well be a better implant for you, and that might be because of your particular circumstances. Do you need a textured implant, which is a bit more likely to grip, for example? Do you need a shaped implant, which only comes with a textured surface? Or will you do better with a smooth implant? It all depends on you, and your surgeon is the best person to advise you of that during a consultation. But I really don't think there's any long-term evidence to suggest that one particular brand or one particular surface offers long-term proven benefits over another. Because if there was, we'd all use them. The other thing to be aware of, if a doctor or a company is particularly enthusiastic about a particular brand and type of implant, is are they making that decision based on clinical evidence, or are they making it for some other reason? You know, having worked in the industry for 25 years, I can tell you that there are hidden incentives that a doctor may have in order to use a particular brand. Maybe he gets a volume discount price and so needs to get a certain number of that particular brand over the line. He's not going to be very likely to offer you an alternate brand. Because all implants are very similar, that might not matter. But they all do come in slightly different sizes and shapes and profiles and so on. And what might suit you best might not be the one that that particular surgeon uses. At Minxed, we offer a range of different implants. I think you can probably have any brand that you particularly want if the surgeon agrees and there's a good reason for doing that. But by and large, there's not a lot of difference between the different implant types. They're all good. You do need to be aware that some companies are better at marketing than others. And we see that with patients who come to us and say, I want this particular brand because it's the best implant. It's not the best implant. There's no such thing. They've just got the best marketing.